Dr. Derek Whiteside. I'm the Medical Director and Chief Medical Officer for Whiteside Technical Solutions Med Inc. Today we'll be going over oral airway and airway management. If there's any questions, feel free to leave them in the comment section. The instruments we'll be going over is 1, the bag valve mask. We'll also be going over oral and nasal adjuncts such as the oral pharyngeal airway and the nasal airway. We'll also go over intubation equipment and LMAs. You're familiar with it. You're already familiar with the BVM. You all know how this works. And we have 2 LMAs. We have the IGL, which is kind of what I like, and the other LMA where you actually have to put air in it. Anytime you get it, you want to always inflate your equipment, make sure the air is there, make sure it maintains the pressure, because when it goes inside the mouth, it's supposed to stay in place.
To insert the LMA into the patient, make sure the airway part of the LMA points towards the lungs or feet of the patient, and then gently insert into the mouth. It may be necessary to open the jaw slightly. Then with firm but controlled pressure, slide the LMA until you feel it seating in the pharynx and the supraglottic area of the patient. At this point, we would select the amount of air, 30 milliliters as indicated on the tube, and inflate the LMA cuff. It's important not to touch the tube itself so that the LMA cuff can seat itself anatomically without interference from outside forces. As we inflate it, we can see the tube seating, and we confirm good pressure in the pilot cuff bulb. One would now ask an assistant to secure the tube with their hands while attaching a ventilation device, in this case a self-inflating bag valve device. Ventilate the patient and confirm chest rise, and also listen into the epigastrium to see if there's any gurgling of air. At this point, you would secure the LMA to the patient and continue with.
Then we have several tubes, combi tubes, and an ET tube that you can use for intubation. What I always like to start off with is your OPAs and NPA, your adjunct airways. So this is your NPA, your nasopharyngeal airway. This is your OPA, the oropharyngeal airway. So when you're looking at it, when you measure for the oropharyngeal airway, it goes from the corner of the mouth to the angle of the jaw, and you want it not to hang over. So if I put it in the corner of the mouth, angle of the jaw, you see how far it hangs over? That's what you do not want. So you want to make sure you avoid that. So then we take another one, put it at the corner of the mouth, angle of the jaw. That's the one that works. So that's what we want to go with. There are 2 methods. Some people do the scissors technique where you keep the mouth open. You go on the side of the mouth, right in the corner, twist it around, and that holds in place.
Nice. When I put the oropharyngeal airway in, I'm going to gently tilt the head slightly. I'm going to insert this upside down to start with. I'm just letting it drop into the mouth. And once it won't go any further, a gentle twist of 180 degrees. And then you can see on this model how it sits neatly with the tip at the edge of the oropharynx, and the curve is following the shape of the tongue, but keeping the tongue out of the way from obstructing the airway.
Other people, they will take it and go towards the hard palate and slide across. I try to avoid the hard palate, and I don't recommend it because you can scrape it. So you corner the mouth and twist it. When you do the NPA, so the NPA comes different sizes. So it's actually from, from the nose, corner of the ear. You want to make sure that's where it goes to. So if I use, let's see, this one, you see how long it is? That's what you want to avoid. So this was the better size. You always want to try to go into the right nair, and that for some reason we know the right nair works. Also, if you look at the bevel itself is what you want to go against the septum, because if you scrape the septum, it's highly sensitive and it bleeds easy. And you literally just take it and gently guide it in. And like we said earlier on the videos, if there's any head trauma, you always want to avoid that. You do not put in the NPA for any head traumas. Okay? And then the other thing is intubation. Not everybody is skilled to do intubation, but we have the handle and the blade. Typically, people like to go with a Mac because it's curved for adults, and they like to go with the Miller because it's more straight. I don't have the Miller with me, but I personally like to go with the MAC. I get a better view of the vallecula and even of the airway when I use the MAC. So those are the things we'll practice. Are there any questions?